We acknowledged that there was a gap in cultural awareness in the wider workforce, and we held various listening events to provide sort of a safe space to enable real, honest feedback from managers, from mentors, and from internationally educated nurses. There were also concerns on communication barriers and inequity and discrimination, and we identified that some nurses were placed to specialty areas which didn't complement the skills and experience. So we've had to deal with all of those issues. The impact of the interventions that we've made, though, have been fantastic. If I look first of all about the pledges of support for our internationally educated workforce, this was really strengthened by role modelling of inclusive leadership by the executive board and senior leadership team here in the trust. Each executive director takes a lead responsibility for each protected characteristic. We've implemented another programme, which is Cultural Ambassadors Programme, supported by our internal race equality network, and that is about really strengthening the messages about workplace culture and supporting our international educated nurses. We've also had a focus on our social media and our communications channels on those nurses who've been able to progress from band 5 to band 6 to encourage career progression for all those international nurses that we have recruited, and we've shared their career journeys on our website and Facebook channels. There's a My Stay and Thrive WhatsApp group that was established in 2020. It's open to all for pastoral support. A further initiative has been reciprocal mentorship, and I'm personally involved in reciprocal mentorship. It's one of the best meetings that I attend on a monthly basis. That creates awareness. It gives me insights and actions that really directly contribute towards the development of a more equitable and inclusive organisation. And then we had a further programme which was called a Spread and Scale Academy. We wanted to spread and scale the success that we'd had on international recruitment across not just our organisation, but across the place in Wakefield and Kirklees where we work, so we could share that best practice. The challenges of working with ethical recruitment partners, the challenges of funding are common to all NHS organisations, but we realised what an immense contribution this workforce brings, and therefore it's important that we funded that correctly, both in terms of financial cash, but also about infrastructure, pastoral support, preparation for OSCE examinations, accommodation. It's never lost on me personally, having travelled to Hyderabad to work on international recruitment previously in my career, about the sacrifices that international educated nurses make to come and work in the UK, and therefore you want to make their experience the best it possibly can be, because you want to retain and develop that workforce for the future. So I think if you look at things through that lens, then you're going to get the employment offering and the experience correct. It's tremendous. Just a couple of months ago, we had an opportunity to celebrate our international educated nurses, and the lecture theatre here at Pinderfields Hospital in Wakefield in Yorkshire was full of nurse recruits, and we had a fantastic evening just talking to one another, learning from each other's experience. The community who access our services see a diverse workforce, which gives them confidence in the organisation and the services that it provides. It's provided a fantastic opportunity for leadership development for all of us as an executive team, all those people who offer mentorship support, all those individuals who manage our wards and departments on a day-to-day basis, who have the benefit of working with people with significant experience coming from working for us from overseas. We've had a really good success record, and we've put a lot of time and effort into OSCE preparation, because I know it's so important from the minute a person arrives in the UK to being registered with the NMC and preparing them for that educational journey, so we can get them to a point of learning and earning at the same time as a registrant. Is just an important key performance indicator, if you like. Visible leadership's important. Visible support from every board colleague's important for this, to ensure that you've got really good retention and that our workforce feels supported at all levels across the organisation. I think the learnings of the board are that, we can extend this to other staff groups, and indeed we have done now to internationally recruited allied health professionals, international recruited midwives, and international recruited medical and dental staff. And if you get that model of support, pastoral, educational, and day-to-day living support right, that is an essential ingredient for a successful Stay and Thrive programme. I think the other learning for the board has been that point about visible leadership, and people do like to see senior leaders in the organisation out and about, showing a real interest, even out of work, for some of the events that we've put on to support our international educated nurses. Don't take small things for granted. You know, away days, picnics, celebrating religious festivals are all things that you really need to pay attention to in your cultural calendar throughout the year in any NHS organisation. So that again has really improved our culture within the organisation. I think the challenge always is to try and get to as zero number of vacancies as you possibly can do. We know that staff only give the best care that they possibly can do when they're working in a team that's fully established and fully recruited to, and our international educated nurses make a real contribution in us delivering zero vacancies, and therefore staff delivering the optimum care they can. And of course patients will then benefit from happy staff. Happy staff is happy patients, and international education nurses have got a real fundamental part to play in that. So again, that's been a learning point for us about the crucial role that they have in terms of getting us to full establishment, but also delivering really person-centred care. You see that, I see that when I'm out and about on the wards for some of our international educated nurses on the wards. I see it firsthand about the care that they give to our local populations. I think share best practice with one another. It's good for board leaders in different organisations or in the same organisations to understand everybody's journey in this regard. We'll all learn something from each other. Work closely with your nurse director colleagues, your allied health professional director colleagues, your medical director colleagues, and just share that practice that you've got about recruitment and retention of international educated nurses, because you can always improve. I think keeping an eye on development. It's not just recruiting newly registered nurses in at a band 5 level in the NHS. You've got to see the careers beyond there. We're getting some fantastically experienced nurses from overseas, and they are absolutely ready for band 6 or leadership roles on a ward. And I think we've got to have the courage to promote that opportunity, give people the development programs they need to rapidly develop to the best they possibly can be. So I think having a laser-like focus on equality, diversity and inclusion indicators around promotion opportunities and people entering into higher bands is a real focus for boards to concentrate on. But listening to the lived day-to-day experiences of our international educated nurses is just as important. What they're sharing with us, you know, they said, we did, we can take intelligent action based on what the feedback we receive to improve our organisation. But this has made such a fundamental difference to this organisation. The organisation's far richer from its involvement in international recruitment, and long may that continue.